Imagine walking into a dentist's office, getting a simple injection, and walking out knowing that in a few months you'll have a brand new tooth growing where you lost one. Sounds like science fiction, right? Well, it's happening. Japan is making this a reality by 2030. But here's the million-dollar question, or should I say the $1,000 question: how much is this going to cost you? Today, we're breaking down the economics of tooth regeneration, comparing it to what you're paying now, and predicting whether this breakthrough will be affordable for everyday people, or just another expensive treatment only the wealthy can access. Let's dive in. Before we talk about the future, let's talk about now. Losing a tooth in 2025 is expensive, and I'm not just talking about the physical pain, I'm talking about your wallet. If you need a single dental implant in the United States, you're looking at anywhere from $3,000 to $6,000 per tooth, and that's just for one tooth. In Japan, it's slightly cheaper, around $2,500 to $4,000. In the UK, private implants can run you £2,000 to £3,000. But here's what most people don't realize. That price includes the titanium post, the abutment, the crown, multiple dental visits, and sometimes bone grafting if your jaw isn't strong enough. The process can take 3 to 6 months, and it's invasive. Bridges, $2,000 to $5,000. Dentures, $1,000 to $3,000 for a full set. And don't even get me started on maintenance costs over the years. So yeah, losing teeth is a financial nightmare for most people, which is why this Japanese tooth regrowth technology is so exciting. But will it actually be affordable? Alright, let's talk about what this treatment actually is. Researchers at Kyoto University Hospital, led by Dr. Katsu Takahashi, have developed a drug that targets something called USAG1 protein. This protein basically blocks your body from activating dormant tooth budsies. You have the man growing a third set of teeth. The treatment is a single injection of antibodies that neutralize USAG-1, allowing your body to naturally regrow a tooth. They've already successfully tested this on ferrets and mice. No side effects. New teeth grew in perfectly. Human trials started in September 2024, focusing on people with congenital tooth absence, those born missing certain teeth. If successful, Phase 2 and Phase 3 trials will expand to people who've lost teeth due to injury, decay, or disease. The goal. But here's the thing. This is cutting-edge regenerative medicine, and cutting-edge usually means cutting-edge prices. So what can we expect? Let's start with the worst-case scenario. When this treatment first hits the market in 2030, it's going to be new, it's going to be exclusive, and pharmaceutical companies are going to want to recoup their research and development costs. Looking at other regenerative medicine treatments, like stem cell therapy, we're talking $5,000 to $15,000 per procedure in the early stages. Some advanced treatments in Japan and the US have launched at even higher prices. So, in a pessimistic scenario, we could be looking at $8,000 to $12,000 per tooth in the first few years. That's higher than current implants. Why? Because it's real regeneration. It's your tooth, not a titanium screw. The biotech companies will argue it's worth a premium. And here's the kicker: insurance probably won't cover it initially. Remember, dental insurance barely covers implants right now. A brand new, experimental treatment. Good luck. In this scenario, tooth regrowth becomes a luxury treatment for the wealthy. Regular people, still stuck with implants and dentures. But, and this is a big but, there's reason to be hopeful. Japan has a universal healthcare system that often covers innovative treatments. If the government recognizes tooth regrowth as a medically necessary treatment, they could subsidize the cost. Plus, as the treatment becomes more common and competition increases, prices always drop. Look at LASIK eye surgery. When it launched in the 1990s, $4,000 per eye today, as low as $1,000 per eye. In an optimistic scenario, by the mid-2030s, we could see tooth regrowth priced at $3,000 to $5,000 per tooth, comparable to, or even cheaper than, current dental implants. Why cheaper? Because it's less invasive. No titanium post, no bone grafting, no multiple surgeries, just one injection and a waiting period. And if countries like India, South Korea, or Thailand start offering medical tourism for tooth regrowth, we could see prices drop to $1,500 to $2,500 per tooth. In this scenario, tooth regrowth becomes accessible to the middle class within 5 to 10 years of launch. Okay, so what's realistic? Let's split the difference. Based on similar medical breakthroughs, here's my prediction. 2030 to 2032 initially costs $6,000 to $10,000 per tooth. Available only in Japan and select private clinics. Insurance, unlikely. By 2033 to 2035, as more dentists are trained, $4,000 to $6,000 per tooth. Some insurance companies start offering partial coverage. By the late 2030s, $2,500 to $4,000 per tooth. Generic versions might emerge. The bottom line, it won't be cheap initially, but it probably won't be outrageously expensive forever either. The good news, this technology is coming, and at WILL change dentistry forever. What do you think? Would you pay $5,000 to regrow a real tooth or stick with a $4,000 implant? Drop your thoughts in the comments below. And if you want to stay updated on tooth regrowth news, smash that subscribe button. Thanks for watching, and I'll see you in the next one. Keep smiling soon. You might be smiling with regrown teeth.